who is not only highly accomplished, but he's also very deeply committed to serving our community. Dr. Enakpene is a board certified OBGYN and maternal-fetal medicine specialist. He serves families here in the Permian Basin. He has over 20 years of global medical experience. He specializes in prenatal care, high risk pregnancy management. He was my doctor when I gave it to my last baby. Complex maternal and fetal health conditions. What truly sets Dr. Enakpene apart is not just his clinical expertise, but his compassion and his dedication to improve the outcomes for mothers and all the families, both in our community and in the Permian Basin. We're truly, truly honored to have him with us here today. So I would like us to please join me to welcome Professor Christopher Enakpene. Dr. Enakpene, thank you so much for being here with us today, and we're all very excited to learn from you. And with that, I'll just hand it over to you and take it on from there.
Yeah, thank you so much, Esther Okoye. Thank you for the introduction, and thank you for the Nigeria in West Texas for this invitation. And it's a very interesting topic that I wanted to talk because a lot of people have asked me, both in clinic or outside clinic, about some of the pertinent issues related to intellectual disability among children. And I just chip in another topical issues, which is what affect us as Nigerians predominantly, which is sickle cell disease. So I will dwell predominantly on the intellectual disability and focus on autistic spectrum disorder, which is an issue that is coming up among our community. In the sense that a lot of people have told me that, oh, we don't have this thing in Nigeria. How come when we come to the US, we are having kids that have this condition? But I want to be different, that is not true. We do have them in Nigeria. It's just that the diagnosis is usually not made, and they may, not link them up to a medical disorder. They may think that it's related to one evil thing or something that the woman did or the family did that affected the baby. So on that premise, that's what I wanted to talk about. What do we do? How do we screen a pregnant woman when you are pregnant to know whether that baby has a risk of intellectual disability with a focus on autistic spectrum disorder? Then we also touch base with sickle cell disease conditions, okay? So let me see why it's not moving. Yeah, trying to move my slide. Okay. Sorry, I'm having issue. Okay, sorry, I've seen my arrow. It
There we go.
was, yeah, it was hidden behind the. So, autistic spectrum disorder is a neurodevelopmental deficit. It affects how an individual perceives the world and also how they communicate and interact with other people. And occasionally, people make that mistake of, thinking that autistic spectrum disorder is actually similar to Asperger's syndrome, even though they manifest with similar symptoms. The time of presentation differs. Most of the time, autistic present as childhood, while the Asperger present at adulthood. And because autistic is a form of intellectual disability, so what is an intellectual disability? And this is a common neurodevelopmental disorder which is characterized by low intelligent quotient. When we say low intelligent quotient, means that if the IQ is 70 or less. In addition, we may have some other areas of deficit, such as behaviors and also adaptive function. And this usually is diagnosed before the age of 18 years. And I need to go back. Oh, okay, sorry. So, intellectual disability is not as common as thought, because when you have a child that has intellectual disability, you would think that the whole world is collapsing on you, that there are a lot of people who are suffering from this, but it's only 1 to 3% of children that do have this intellectual disability among all children that are born. And intellectual disability can be classified and because it tends to be higher in areas of lower socioeconomic class and also in developing countries, especially the mild form of intellectual disability. Unfortunately, male children tend to have about 30% more ID more than female in the mild cases. However, the ratio usually decreases as the IQ decreases. That means as we go into severe form of intellectual disability, the ratio between male to female decreases. Mild form is about 30% of male more than female. When you're talking about severe form of intellectual disability, it's usually more prevalent in female than in male in some communities. And intellectual disability can be classified in two broad groups. One classification by IQ, and the second classification is syndromic or not syndromic. When we classify intellectual disability using IQ, it's usually divided into 5 groups. We have the mild, we have the moderate, we have the severe, we have the profound, and the fifth one is unable to classify. This is based on the intelligence quotients, which we are soon going to talk about. And the prevalence of intellectual disability is usually relatively stable, especially when it involves the severe form. However, the prevalence of mild intellectual disability is variable, and it depends heavily on the external environmental factors. This is going to be very important in when we are talking about autistic spectrum disorder. So, because having a knowledge and having issues in regards to how the environment works and impact health will also play a significant role. And this level of prevalence is dependent on the level of maternal education, also depend on access to quality education and opportunities, including early childhood intervention. These are children who are already born, who are diagnosed. What do you do to ameliorate their symptoms or their disability? If you expose them to quality education and other opportunities, you may be able to have a better outcome. And access to healthcare plays a significant role, especially during pregnancy. There are a lot of things that happen during pregnancy that can affect the well-being of that baby. For instance, a woman who delivers very prematurely may affect the functioning of the brain of that baby if it is an extreme prematurity. A woman that is exposed to teratogen, infection, all these things are all going to play a significant role in the health of that baby. Then the nutrition, nutrients, and vitamins, these are also very important. So how do we inherit genetic diseases? There are different forms of inheritance of genetic diseases. The first one is what we call autosomal recessive inheritance. This is a form of inheritance whereby an individual is a carrier of the disease that is causing, of the gene that is causing the disease, but the person does not have the disease. It's just a carrier for it. An example of autosomal recessive disorder include sickle cell disease, cystic fibrosis, infantile polycystic kidney disease. And those who are carrier, they need to have a partner who is also carrier for them to have a baby that is affected. And if both a couple are carrier for the disease, they will have a 25% chance of their baby having that disease. And if they are also carrier, they will have a 25% chance of having a baby that is normal. And they will have 50% chance of having a baby that is also a carrier. So 20%, 25% chance of having an affected baby, 25% chance of having a baby that is normal perfectly, and 50% chance of having a baby that is also carrier. That is what we call autosomal recessive. Both father and mother has to carry that gene. Autosomal dominant, you just need one parent to carry the gene. And if one parent carry that gene, there is a 50% chance that that baby is going to express that disease. Okay? There are many diseases that are autosomal dominant. We have autism disease, neurofibromatosis, adult onset polycystic kidney disease. We have seen a lot of this in recent time. These are usually manifested by early onset of high blood pressure. that are usually not amenable to medical therapy. And during evaluation, we do ultrasound, we do images, you find out that this patient will have a lot of cysts in the kidney, and it can be very devastating. And some of them, if it's not handled well, they can develop early onset of stroke or develop end organ damage like kidney diseases, and also develop heart failure. It's very serious. Then the third one is S-linked. The S-linked disorder only affect male. As you know, human beings have 46 chromosomes, and all these chromosomes, they exist in pairs. We have 22 pairs, we call them autosome, and we have one pair, we call it sex chromosome. In a male, it's XY. If you have XY, you become a male. If you have XX, you become a female. This gene is only carried in the X chromosome, which means that if if a woman transfer one of the X chromosome that has this gene to form a male child, that male is going to manifest with this disease. But if it transfer it to a female, because the female has another X chromosome, that female will not manifest the disease, but the female will just be a carrier. So, and as you know, this is a disease that would actually, one of those diseases we call hemophilia, color blindness, Duchenne muscular atrophy. In the olden days, the royal family in the UK, they used to marry themselves because they didn't want their blood to mix with other people's blood, until they discovered that male in that family were dying. They didn't know why they were dying. So that's how they find out, because they have that gene, they marry themselves, they continue to propagate that gene, and which affect only the male, and it did not affect the female. So the male were dying. So that is how they found out hemophilia. That after a lot of thorough evaluation, they discovered that hemophilic disease. Another way somebody can inherit a genetic disease, what we call epigenetic disorder. This is how behavior and environment can cause changes that affect how gene work. This is not usually transfer like we transfer like a recessive, autosomal, or S-link. This is an interaction between your gene and your environment, that there is an event that can happen in your environment that will affect how your genetic material are being expressed. So copy number variance, I just wanted to quickly measure this because this is a form of inheritance which is sporadic. It just occur, we call it de novo, spontaneous, means that the parents may not even have it at all. It just occur in that child. And they usually don't alter the way the DNA are arranged, but it acts as a chemical tag that can switch a gene on and off, which will determine the proteins that we produce. In some cases, they can be passed down from generation to the next generation, but they are usually modifiable and they are not permanent, okay? Example of this copy number variance is loss of genetic material in a region. We call it deletion. Or in a region of the DNA, we have a duplication. We call it overexpression, which will result to overexpression of the protein is produced. This is just a diagram expressing a family that is carrying autosomal recessive gene, okay? The area that is black, this square is a male. The round one is a female. The black is a person who is carrying the gene. It doesn't have the disease, okay? So a male who is carrying the gene marries a female who is perfectly normal, and they have 4 children. And when they have these 4 children, what do they have? One of the children is also carrying the disease. As I said, why 3, of those children, they don't carry the disease, okay? Let's now go to the right diagram. We have a female who is a carrier, marry a male that is normal, and they had 3 children, and one of the male is a carrier. Unfortunately, number 10 and 11, they married themselves. 11 is a carrier and number 10 is a carrier. And unfortunately, when they married themselves, the 2 babies they have manifested with the disease. So you need to have a male and a female that are carrying for the disease to manifest. So this is how DNAs are arranged in a body. So they normally arrange in a form of each of these strands, we call it chromatid, and they join together at a point, okay? If you see this area that is highlighted yellow, this is an area of the chromosome that is carrying this gene. As you can see, this particular person has two chromosomes that are carrying the same gene. And if this person is going to manifest with the disease, and you look at all these other ones, they are not carrying the same material. Okay, this is how the genes are scattered all over the place, and there are 46 chromosomes in a human body. Then let's talk about autosomal dominant. This is autosomal dominant. As I said, if you are autosomal dominant disease, you have a 50% chance of having a baby that is affected. This is a family that has both mother and father, they carry the gene. And because they carry the gene, they have 3 children. 2 of the 3 children are affected. Now, look at this, the right side, number 3 and 4. A female does not carry that gene. The male carry the gene. And they have 2 children. Number 9 is affected. Number 8 is not affected. Luckily, number 8 married number 7. They have 3 children, and none of the children is affected. So that is how it is very important. So look at all those factors. When people are trying to marry, there are some tests now we do to check whether are you carrying this genetic disorder that can be passed down to the children. So epigenetic disorder, as I said, these are not inherited in a normal pattern. These are things that happen in your gene, it interacts with the environment, and it results to a change in the expression of the protein that gene produced. They are usually very flexible gene expression, and the disease associated with this type of genetic disorder, they are preventable potentially. And some of the therapeutic disease, some of the treatment can actually alter the outcome because of this. So if you heard about gene therapy, this is area of diseases that when you modify that genetic material, you just modify it, it will change the outcome, and that person will get cured. For instance, if a person has a DNA, they had a metal group, we call it methylation. And in a segment of that DNA, is going to affect how that DNA is producing protein. So if you want to do a gene therapy, you can target to remove that methyl group. When you remove it, then you cure the person. The person doesn't express that protein that is resulting to the disease. Another way we can modify a gene, what we call epigenetics, is what we call histone. As you saw those chromosomes we saw recently, let me go back to it. As this chromosome, each of these chromosomes carry DNA, and this DNA is like they wound around a base, and that base is called histones. Okay, and that histone, it makes the DNA to either tighten or loosen. If it is tightened, it exposes this gene, it turns it on. That means it can express the protein is meant to express. If it is hidden, that means it turns it off. That means it cannot express it. So we can actually modify a disease caused by this that affects histone modification. And by switching it on and switching it off, then we cure that person. Then we call it gene therapy. So what are the causes of intellectual disability? They can be caused by environmental or genetic factors, okay? And about 60% of intellectual disability are usually, you don't find any identifiable causes. But the environmental causes include exposure to teratogens, and teratogen, like you took you take a medication, and that medication alter how your DNA is expressed. Then viral infections, and we all know HPV viruses. I don't know whether anybody knows HPV virus. HPV virus is a virus that has been linked to cause cancer of the cervix, cancer of the throat. You know, this virus binds to the DNA of the host, and it alters the way the host DNA express protein, and it makes that cell to be immotile. That means that the cell will not die. Every cell have a lifespan that after a certain age, that cell should die. But if a cell is bound to HPV virus, it makes that cell not to die. Because it doesn't die, that doesn't prevent newer cells from forming. Over time, it's going to grow into forming a mass, and that's what we call a tumor or a cancer. A child who is also exposed to severe head trauma that can cause lack of oxygen to the brain can also result to intellectual disability. Above all these factors that we just described, they usually cause what we call non-syndromic type of intellectual disability. What are the genetic causes of intellectual disability? The genetic causes present in 25 to 50%. And there are specific chromosomes that are associated with intellectual disability. I'll just mention a few of them. One of them is Down syndrome. The other one is Klinefelter syndrome. Down syndrome just means that instead of this patient having 46 chromosomes, that is 23 pairs of chromosome, they have 47. At position 21, they are carrying 3 chromosomes instead of 2. The Klinefelter syndrome is also 47 chromosomes. This is a male who's supposed to have XY, but unfortunately, the may have XXY instead of only one X, and it's also associated with intellectual disability. Then other intellectual disabilities that are resolved from copy number variant, we call it DiGeorge syndrome. All these newer causes of intellectual disability are things that have been identified in the last 15 years that are makes more people to make a diagnosis of intellectual disability. And unfortunately, most known non-syndromic intellectual disability are linked to the S gene. We are soon going to talk about it. But as you know, most of these causes are multifactorial, which means it has a genetic component and they also have an environmental component. So let's talk about autistic spectrum disorder. I'll just have about 2 slides on this. A classical autistic spectrum or autism is associated with early delayed speech or intellectual impairment. Approximately 10% of autistic are associated with genetic disorder, while 90% are multifactorial. Some of the interventions like in vitro fertilization procedure, whereby they manipulate to inject sperm into the cytoplasm, the egg of the woman, that can trigger an expression of a gene that is pre-mutation into full mutation, and it now make that child to manifest as autistic. I'll talk about that. So these other ones are the chromosome, but I don't want to dwell about that. But the one I want to dwell about today is one that we have identified. They call it Fragile X mutation. What is Fragile X mutation? For every DNA, there are 3 base pair or that synthesize protein. For patients who have Fragile X, the CGG replicates itself more than 55. I will explain what that means. These base pairs, we call it a base pair. They are base that influence the production of protein. They can repeat themselves several times. You can have CGG, CGG, all like that. But if the repetition is less than 45, you are a normal person. If the repetition is between 45 to 54, we call that person is intermediate. And if the repetition is between 55 to 200, that person is pre-mutation. And if the repetition is 200 and above, that is a full expansion, what we call a full mutation. What is the significance of this? Patients who have full mutation of Fragile X are going to become autistic. There's no doubt about it. Okay? If you have a woman or a man who have pre-mutation and that mutation become expressed, maybe they undergone IVF and they did manipulation, and instead of remaining a pre-mutation, then it become expanded to become full mutation. That baby is going to manifest with autistic spectrum disorder. But for a woman who has that pre-mutation, even though it does not manifest with autism, but they are not completely free of disease. These are women who are more prone to develop premature menopause. Premature menopause is defined as menopause that occur in a woman before the age of 40. And a male who carries this pre-mutation, we call them Fragile X-associated ataxia. This male usually manifests with disability, inability to walk, or inability to stand erect. They will be staggered, and it usually come up in the 5th to 6th decades of life. So even though the man does not have the disease, but the mere fact that it carries that gene, they can manifest with some diseases later on in life. So what causes Fragile X? When there is expansion, that Fragile X is supposed to produce a messenger. I mean, so it's supposed to influence the function of a gene. That gene, we call it Fragile X messenger ribonucleoprotein 1, okay? And what does it do? It is needed for brain development. It produces protein that is needed for brain development. Imagine a child who has a full mutation. That means that protein is not going to be produced. That brain is not going to develop well. Then also, those who are a pre-mutation, it's not that, I mean, those who are having Fragile X associated, they can still produce some protein. That's why you don't have pre-mutation manifest with autistic spectrum disorder. And unfortunately, it affects both males and female, but female usually have a milder symptoms than male. It isn't being that that gene is in the X chromosome. Because it's in the X chromosome, a woman has two X chromosomes. If one of them is carrying a manifestation of that condition, the other X chromosome can rescue the one that is diseased. Okay, it can help it out by make sure that it performs the function of that one that has the genetic disorder. That is what happens in a normal sense. But in the situation, if it's a male only have one X chromosome. It doesn't have any other. And unfortunately, the Y chromosome carry very little genetic material comparing to female anyway. So female X chromosome carry more genetic material. So if the X that is donated to form a male is the one that is affected, that male is going to manifest with a full-blown disease. That's why you are more likely to see autistic spectrum in a male children than female. Even though there are some times you can find female, but they usually have a milder form of the disease. Okay? Then let's talk about sickle cell, then we'll round up. So Nigeria is the global epicenter of sickle cell disease, and it accounts for over 150,000 newborn cases and over 100,000 under 5 deaths annually. In the whole population of Nigeria, 4 to 6 million of Nigeria, they live with sickle cell disease. This is a significant amount of a population, 4 to 6%, which is approximately about 8% of Nigeria population are actually suffering from sickle cell disease. But the gene, which is the sickle cell gene, is found in 25 to 30% of Nigerians. Those are the ones we call the sickle cell trait, okay? And unfortunately, Nigeria carries approximately 80% of the entire Africa disease burden. And that's why we call Nigeria the sickle cell capital of the world, okay? And the childhood mortality is usually critically high, and the life expectancy is approximately 21 years. But with the onset of development of medical innovation, that age has been increased. We now have sickle cell who live up to 60, 50 these days because of better management. But generally, overall, if you grow up in an environment that don't have access to good health care, the average life expectancy for a sickle cell patient is 21 years. And unfortunately, in the present day Nigeria, they don't have a universal screening for newborn, as we do here. In this America and many Western countries, any child that is born, we undergo newborn screening. So, and unfortunately, people living with sickle cell in Nigeria, they are highly stigmatized, and that can result to a high rate of anxiety and depression. So, and the sickle cell exists in different form. We have a normal person is what we call hemoglobin AA, and when you are a carrier, we call you sickle cell trait. You have hemoglobin AS or you have hemoglobin SC. Then sickle cell anemia is that your mother has sickle cell trait, your father has sickle cell trait, they got married, and both of them donated the S gene to you. The person becomes sickle cell anemia. That person is a full-blown sickle cell. There are other forms of sickle cell that usually are not well known in Nigeria, but there are some Nigeria that suffer them. We call it beta thalassemia, and we also have alpha thalassemia. Beta thalassemia is predominantly found in the Mediterranean area, while the alpha thalassemia is usually predominantly found in the Southeast Asia. So we want to quickly talk about gene pool, why it is important. In this world, There are some certain tribes who don't want to associate with other people. They just want to mix with themselves alone. One of those tribes is what we call Ashkenazi Jews. They don't marry other people, they just marry themselves. Because they marry themselves, they propagate these genetic materials among themselves. So these people are prone to certain gene conditions, like the Tay-Sachs disease, the Gaucher disease, BRCA1 and BRCA2 gene disease. BRCA1 and BRCA2 genes have been linked to breast cancer and ovarian cancer, even though we can find it in other populations. But when you look at this Ashkenazi Jew, these are the people that have a very high prevalence of this gene disorder. Other isolated pool genes are Mennonites. Mennonites were, they came from Middle and East Asia, Europe, and they came to America. They formed their religion. They live among themselves. They don't mix with other people. And I have seen a lot of them coming up with babies that have serious congenital abnormality. This is because they don't mix with other people. They propagate this gene over and over and over again. So Amish, as you know, they broke up from Mennonites. Amish were the group that said, oh, Mennonites were not conservative enough. They want to be more conservative. So they broke up. They also have what we call intermarriages. They don't marry other people, and they also propagate this genetic material. And this can result to a lot of conditions. Does anybody have any question? Maybe I can stop here now so that people can ask questions.
Thank you very much, Dr. Enakpene.
Yes.
I have some people sending me their questions directly. So we do have a question in the chat. It says, what can mothers do during pregnancy to reduce the risk of of autism?
That is a very good question. As I earlier highlighted, autistic spectrum disorder have a genetic base. As we said, 10% of them are going to be due to the gene. And some of those genes are the chromosome I've pointed out, which is Fragile X. Then we have a chromosome 16. We have a chromosome 15. All these are all genes that can, unfortunately, there's nothing you can do about that. We can diagnose them early and, prevent. We'll make a diagnosis and say, oh, this child, this is what is likely going to happen. But other things you can do, because 90% of autism are multifactorial. As I said, if somebody who had premutation of Fragile X, if that person is exposed to teratogens, like drugs that you are not supposed to take, food that you are not supposed to take, viruses you are not supposed to take, or you are exposed to radiation, it can make somebody who is pre-mutation to go into full mutation. Pre-mutation does not cause autism. It is when it goes to full mutation that it will cause it. So unfortunately, many women don't know that they are pregnant until they are about maybe 6 weeks to 8 weeks pregnant. They don't know. The most critical period of pregnancy is between the 3 weeks of conception to 8 weeks of conception. That is when organs are formed. And God is very kind. That is also the week associated when women have nausea and vomiting. This is what we call a biological adaptation. God is preventing the woman from consuming some materials or some food that may have a deleterious impact on that baby. This is form of ecological adaptation. So I will say, if you are a woman who is in reproductive age, you have to be careful about your exposure, especially radiation, especially some chemicals. I will give you an instance. I had a patient who had a baby. The baby has what we call skeletal dysplasia. I was not the one that took care of that pregnancy. Of course, the baby died. She was pregnant the second time. This woman came to me. She had another baby with skeletal dysplasia. I was trying to find out. I was stacking my brain. Why is this woman having this? She had it before. She had it the second time. On reviewing her job specification, this woman is a chemist in the oil field. And she worked with a chemical, what we call toluene. That is the name of that chemical. So she's constantly exposed to this chemical. And this chemical has been linked to causing skeletal dysplasia. That is why her first pregnancy, she has an affected baby. Second pregnancy again, she's having an affected baby. So I just told her, you need to either they take you off from the lab or you change your job if you want to get pregnant and have a normal baby, because you are being constantly exposed to this chemical. So that's what happened. So we have to be careful of what we eat. We have to be careful. There are local food, a lot of local food in Nigeria. People will tell you, eat this, eat this. Unfortunately, not many studies have been done to check about the safety of this food. For I know about Nigeria, when a woman gets pregnant, they give them this product. It's like cement, and they say you be patient, you eat it. I don't know what it contains. I don't know whether it harm the baby. So we don't know what all these things. Anything you don't know, don't say because it was handed down to me by my grandmother to my mother to my mother, because this is what we do in our locality. I must do the same thing. I will advise that you should be very careful if you are in a woman in a reproductive age group. Other things you can also do, if you are planning to conceive, I usually tell women to start taking prenatal vitamin and folic acid 3 months before conception to prevent some of the other conditions that can happen to that pregnancy. At least 3 months before your conception. Don't conceive based on chance. Plan your pregnancy so that you know what you prevent yourself from being exposed to. Did I answer your question? Whoever that asked that question?
Yeah, I think so. Well, thank you, Dr. Enakpene, for the next question. Thank you, Dr. Enakpene, for taking time out of your busy schedule to educate our community. We truly appreciate your leadership, expertise, and your commitment to improving maternal and family health in the Permian Basin. The question is, if both parents are sickle cell carriers, what options are available to them?
That is a very good question. You see, that's one of the reasons why I put sickle cell there, because I have dealt with a lot of these conditions. Unfortunately, many people don't check their what we call their hemoglobin and genotype before they get married. Now you are find yourself you are married, you cannot divorce and say because so there is a 25% chance you are going to have a baby that has sickle cell. There is a 25% chance you're going to have a baby that is normal. And there is a 50% chance you are going to have a baby that has a carrier. So what we do is that when you get pregnant, we can do what we call maternal carrier screening. Before, men don't know about their genetic material because women are the one getting pregnant. We screen all of them. So when we found a woman who has a carrier, we usually screen the men. But fortunately, we don't screen the men anymore. They can do a reflex testing of that baby DNA in the mother's blood to identify whether the baby is a low risk or high risk. If the baby is a low risk, means that the baby is either normal or she's just a carrier. But if the baby is a high risk, there is a potential increased risk that the baby may have sickle cell. So what do? We do what we call diagnostic testing, whereby we do amniocentesis. So we do amniocentesis to diagnose whether that baby has sickle cell. And if that baby has sickle cell, we let the patient know your baby has sickle cell. Then you make up your mind, what do you want to do with that pregnancy? Whether you want to continue to be pregnant or you take a decision to do what you want to do. People who grew up in an environment that have children that have sickle cell, they are more likely to take the decision to say, no, 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 I don't want to continue with this pregnancy. We can make this diagnosis as early as 15 weeks to tell you that your baby has sickle cell. So you make up your mind what you want to do. But that is not the end of the world. As the innovation is continuing to improve and improve, now we now have what we call bone marrow transplant. So what do? If I know that your baby has, that's why prenatal diagnosis is very important. If your baby has sickle cell, the fetal red blood cell is different from adult red blood cell. It does not contain sickle cell. Okay? The infant red blood cell does not contain sickle cell. That is the type of woman I will advise to do what we call cord blood banking. Okay? When that baby is being born, you contact a company, they will give you the kit. You bring that kit to labor and delivery. They will collect the blood from the umbilicus when the baby is born. And they will keep that blood, it can keep that blood up to 25 years. Okay? What is the advantage of this? For bone marrow, for bone marrow transplant, it's very difficult to get a donor unless you have an identical twins. And even when you have a donor, the risk of rejection, the risk of that child being on immunosuppressive therapy for life, and which can result to secondary cancer, is there. So when you have a child that you know he has sickle cell, you keep the cord blood in a blood somewhere. When that child gets to a certain age, they can use that cord blood because you know that that cord blood does not contain sickle cell. They can use it as a bone marrow transplant for that child. And you cure that child. There is no risk of rejection. There is no risk of exposure to any immunosuppressive therapy, and there is no risk of secondary malignancy develop. That is one aspect. Of course, the newer aspect now is gene therapy. Remember, I talked about modification of a gene of when I was talking about methylation and histone. They can do that now, but that is a, I think the first patient that was done was just North Carolina. I read it about 3 weeks ago, whereby they intervened, they cured that boy, they altered the gene, and the boy got cured. So those are the interventions if both couple are carrier for sickle cell. Did
Thank
I
you
answer
very
your question?
much.
Yeah.
Did that answer your question? I think they said yes. Then our next question, are there any medications taken during pregnancy that have been linked to an increased risk of ADHD or developmental issues?
That is a very good question, in the sense that, what I said is there some of these medications have actually, they have done a lot of studies. Like now, let me put it, recently our uncle at the top say women should not take Tylenol because Tylenol causes autism. But it's not true, because there was a study that have been done that includes 6 million children. They did not find any relationship between women taking Tylenol during pregnancy and autism. But as I said, autism can, even though somebody may have pre-mutation, exposure to certain medication can make that pre-mutation to expand, and that can result to, unfortunately, most medication we are using in pregnant women were not tested, because the ethical consideration does not allow pregnant women to be recruited for any study. So most of the medication we are giving to women now, these were medication that were incidentally, like now I have a woman now who is pregnant, who took GLP-1 agonist. He took Mounjaro. She didn't know she was pregnant until 8 weeks. When they did Mounjaro study, they didn't include pregnant women. But now she took it. Now we are following up because we don't know what impact it's going to have on it. So over time and over years, when we have had a lot of women who have been exposed to Mounjaro, we can now review their cases and say, okay, 1 million people were exposed to Mounjaro, 1 million people were not exposed to Mounjaro. How many of them have babies that have autism? How many of them have babies that? So that is how we come about it. So my own advice is that do not take medication that is not usually recommended. Don't listen to friends. Don't listen to what you read online, because some of these things may cause, especially during that window of 3 weeks and 8 weeks, which is the window of embryogenesis, when all these organs are being formed, including brain development. So that is what I can talk. In regards to ADHD, well, there are some antidepressant medication that actually has been linked. But when you're talking about association, meaning that there is no strong evidence, okay, at this moment. But if it is not important, I usually tell my patient when they are depressed, they are pregnant, I ask them, do you really want to take this medication, or do you want us to wait to see whether you can go for counseling? Because when you have all this depression, anxiety, medication is not really the first line of intervention. You can go to psychological therapy. I mean, Mrs. Bajomo is one of us who can counsel, who do all this counseling. So you can undergo that way. It is only when that fails that we can now say, you know what, at this point, let's try medication. So there are some actually, but there are not many that have been associated to autistic.
Thank you very much. Next question. The person said, can someone be taking prenatal vitamins, including folic acids? I'm guessing they mean if you can take it if you're not pregnant. I don't know if that
That
person
is
can
correct.
clarify.
Yeah. So in my earlier statement, I said any reproductive age group woman who trying to get pregnant, I will advise you to take folic acid and prenatal vitamins, because the prenatal vitamin contain a lot of vitamins that help brain development. As I said, many women don't even know that they are pregnant. Some women, we only get to know they are pregnant when they are already 6 or 8 weeks. At that time, the time of embryogenesis has already gone when all these organs are formed. So you don't want to be caught unaware. I will advise you can take prenatal vitamin, even though there is folic acid in prenatal vitamin, you can take extra folic acid because the absorption of folic acid varies from one individual to another. Those who have diabetes, they don't absorb folic acid very well. Those who are obese, they don't absorb folic acid very well. Moreover, folic acid is a water-soluble vitamin. What does that mean? If I take all the folic acid in Midland and Odessa combined, it will not harm me because it's water-soluble. So it's not too much for you to take folic acid in addition with prenatal vitamin. So I strongly recommend any woman who is planning to be pregnant to take folic acid and prenatal vitamin even long before you got pregnant.
Thank you very much.
You're welcome.
Our next question, what advice would you give families who receive an abnormal prenatal screening results?
When you receive an abnormal prenatal screening result, I will advise you to tell your OB to refer you to a high-risk OB. This is where we come in, I mean, the MFM, because the usual OBGYN do not have the wherewithal on how they are going to go from there. So you come to the high-risk clinic, the high-risk clinic is going to now see whether are we going to do a diagnostic testing to really see, because this our screening result is not doesn't mean it's 100% true. So instead of you to be to be afraid throughout your pregnancy, unknown, you don't know whether the baby has it, doesn't have it. The first thing is you want to make up your mind, especially for sickle cell. As I said, if you know your baby has sickle cell, you can now start planning to go out to contact a company that is going to give you the cord blood banking so that you get the kit. You register online, they will send the kit to your house. On the day of your delivery, you bring it to labor and delivery. Even if you do a C-section, you bring it. We collect that cord blood. We give it back to you, and you send it comes with a courier package, and you send it back to the company. I think you pay yearly subscription, just like we pay subscription for app, so that they will keep that blood until when that child get to an age. I think the least age now they do bone marrow transplant is 6 years. So when that child get to that age that he will need bone marrow transplant, they can use that cord blood to transplant that baby, and the baby will not have rejection. That will be 100% cure. No rejection, no need to use the immunosuppressive therapy. That will increase that child of developing what we call secondary malignancy or secondary cancer.
Thank you very much. That's so helpful because I know sickle cell is something that is very prevalent in our community. I personally have a lot of friends and even family that have sickle cell. And our next question, there's a lot of concern, especially in our community, about whether childhood vaccines are linked to autism or ADHD. Based on medical evidence, what should parents understand about this? And what I want to add to this too is in Nigeria, it looks like autism is not very common, and it looks like we're having a higher occurrence of it here in the US. Is it because we have better ways of diagnosing it, or is there something that is making of us have more occurrences of autism, ADHD? We're seeing more of it in our community here in the US than in Nigeria.
So in regards to vaccine, that is still an area that is debatable. But based on evidence available now, they have not found any vaccine that increases the risk of autism. Okay? That is at this moment. Medicine evolve. Maybe we are going to find in the future, but at this moment, they have not found. That's why if you look at childhood vaccination, they give this vaccine at various ages based on whether that vaccine is a tozoid or is a live virus or is just a chemical. Those are how we give vaccine to children. Those are the live viruses like measles virus. That's why we don't give measles vaccine until the age of 6 months, where the brain of the baby is already developed. If we mistakenly give it maybe before that age, maybe it's going to cause something because it's a live virus. So I don't know whether this is going to result in the future. Then in regards to, do we have more autistic spectrum disorder now in the US than where we have in Nigeria. In Nigeria, our problem is that we link a lot of things to a lot of other things. Okay? Secondly, we are very secretive. A family that have a baby that may manifest with autistic spectrum disorder, they will hide that baby. Nobody will know. They won't tell because to them it's a stigma. Because if you see an autistic baby, it's very, very disturbing and it can be very distressing to the family. So they will hide that baby from the public so nobody will know. That is one aspect. But here, I mean, we have better diagnostic criteria, we have better access to healthcare. Maybe. But as I said earlier, autistic spectrum is a multifactorial. Maybe there are some chemicals here we are more exposed to in the United States than we are not exposed to in Nigeria that will also increase the prevalence of autism among our population because that is where the epigenetic comes in, where environment interact with the gene and it makes the disease to manifest. So there is a possibility that we have, of course, other things I want to say is a gene pool. You know, I talked about the Ashkenazi Jew. I talk about Amish. I talking about Mennonite. You know, in Nigeria, Yoruba want to marry Yoruba, Igbo want to marry Igbo, Hausa want to marry Hausa, and all those. There's nothing wrong with all these things. But there are some, I know that the Southwest have a higher prevalence of sickle cell disease because of their proximity to the ocean. And sickle cell was a gene that developed de novo, what we call, how do you call it now? Genetic polymorphism due to adaptation to prevent dying from malaria. Okay? So all these things also play a significant role. If you people of the same village are married themselves, there is a possibility that there is a gene that is propagated in that village. Then you just transfer it to your children. I know, Esther, your husband is an Anambra, you are from Benue State. That is a good one. I mean, the chances of having gene that are going to be carried over is low. I'm not saying that people should go and look for people from outside tribe to marry, but I'm just using that one as an example that I must marry from my tribe, I must marry from my village. You also have the consequences of propagating hidden gene that were not there before.
Oh, that's a very interesting point of view for that. I didn't think about it that way. Yeah, another question that we have is there has been a growing use of IVF in recent years. Is there any evidence linking IVF pregnancies to a higher risk of developmental disorders like ADHD and autism?
That is true. I pointed it out as one of my causes of autistic. You remember I said some women who carry, well, not just women, men, women, they have pre-mutation. That means the repetition of that CGG is between 55 to 200. That person is pre-mutation. The person does not have any autism or autistic spectrum. But the procedural, I mean, the process of doing IVF, especially the one that involve dealing with a man that have a low sperm count, you have to take the sperm and inject it into the egg of the woman. That can make that pre-mutation to expand and it now produce a full mutation, what we call full mutation that can result to autistic spectrum disorder. It is true that IVF process can increase the risk of ADHD, it can increase the risk of autistic spectrum disorder and all this stuff. It is true.
I think we're almost at time. Any other questions from anybody? Any more questions? I don't see any more questions in the chat. Well, in the absence of any more questions, thank you very much, Dr. Enakpene. This was a very insightful session. I personally learned a lot. And I know everybody else in the community learned from you, and we're very grateful for you taking the time to share your knowledge with our community. And thank you everyone for joining, and happy 4th of July, everyone.
Thank you so much, Esther. I appreciate your commitment.
Thank
Okay.
you.
Yeah, you're welcome.